Welcome everyone to our latest guest panel webinar, where we bring in friends and people that we know that work in global and public health in different areas. So you can hear more about their career stories, how they moved from one area to the next, how they transitioned to public or global health, and also understand a little bit about their current jobs, what they look like, and ask them questions about anything that you would like to know about the organizations that they work in or that they have worked in the past. So welcome everyone. Very happy to have you here. There's a Q&A tool where you can use to add any questions that pop up in your head as we talk with our guests today. The way we're going to do this is I'm going to ask questions from the three of them, and we'll leave some good time for questions and answers from our participants at the end. Thank you so much for being here, and thank you, Sabine, for organizing. I am going to very briefly introduce you to our three guest speakers today, all of whom are people that I know closely and I've worked with in the past. So first on, I have Ines. Ines actually spent some time with us here at the Landa. She is an emerging global health researcher specializing in women's health and has an educational background in international emergency and disaster relief and in global health. She has worked with NGOs, with a German NGO where she collaborated with the Guinean stakeholders to enhance the quality assurance of the Guinean health system. She has also worked in academia, where she is now engaged in numerous research projects at University of Heidelberg. And she has volunteered at a number of local and international NGOs, which has provided her with valuable experience and opportunities. And I'm hoping to hear more about all of that, because I think that's a great door opener, Ines. So welcome. Next, we have Tini. Tini also spent some time with Alanda a couple of years ago, and she's currently a project manager at the Fred Hutchinson Cancer Center. She transitioned from biomedical sciences to a master's in public health at the University of York in England. And after that, she became passionate about learning more about public health during her final year at the university. She is interested in understanding and improving health equity and equality in underserved populations. And she is working right now in Seattle, conducting research surrounding the uptake of lung cancer screening in the LGBTQ community and indigenous populations. So I hope you can tell us more about that. Tini, welcome. Good to see you again. And last but not least, we have Rachel, with whom I worked many years now. And she's a senior emergency health officer, risk and surveillance at the International Federation of the Red Cross and Red Crescent Societies. She's based in Geneva, and she provides technical support to regional IFRC and National Red Cross and Red Crescent teams, mostly related to epidemic preparedness and response activities, also surveillance and anticipatory action for health. She leads the community-based surveillance strategy at the IFRC to improve early detection and early action to potential outbreaks, and linking CBS to national surveillance systems. So this is the area where we have worked a lot together in the past. And previous to joining the IFRC, she has worked with various other UN nonprofit and academic groups in the humanitarian sector. So if you're interested in these areas, we're keen to hear more about her story. She has a Master of Science in Public Health from Johns Hopkins University and an undergraduate background in anthropology. So here's another person who switched to public health from a different area, as we all do. Welcome all, so good to have you here. And I wanted to start by asking you each a little bit about your career story. Rachel, would you like to get us started? Can you tell us about, what is the career path led you here? How did you switch from anthropology to global and humanitarian aspects? A little bit of where you worked before and your work at the IFRC. anything you want to tell us would be fantastic.
Yeah, sure. Thank you, Candela. And hi, everyone. Um, it's so funny. I like to say there's two ways that we think of career path. One is what everyone thinks they see, and one is the one we all feel when we're actually following it. So one is like a nice even line, and the other one's more of a twisty road. I also say that in my view, anthropology for public health, they're completely integrated. And so for me, um, I actually feel more and more these days that I am using some of my undergraduate background in anthropology. So just to say on that side, for those of you interested in how to link those, very happy to chat. But I did start with an interest in global health and also more on the side of disaster risk reduction and in emergencies from an anthropological perspective. And so I ended up writing my undergraduate thesis on kind of the anthropology of disaster and how people respond and manage with grief. And how humanitarian organizations are constructed and how they interact together. So even at that point, I was very interested. Um, to be honest, right after undergraduate, though, I took a bit of a different road, I think, than many others these days do. And I felt strongly to take a few years to work before going back to graduate school. And at the time, it was a bit of a challenge. And so I ended up working in a completely different sector for several years, not related to health, not related to emergencies, and basically built off of my, we can get into it later, into my other backgrounds, and just had a regular, normal life, and then realized, no, I want to go back to school like I had always planned. I just took a few years to decide to really do it. And so I ended up, when I applied to master's, I applied to humanitarian health programs. I also applied to scientific journalism programs. I also applied to climate change and society programs. And I also, I can tell I was laughing, thinking this all makes sense. I also applied to humanitarian translation to technology programs. In the end, got into some, didn't get into some, and decided really to go deep into kind of the humanitarian health, public health sector, thinking that if I do want to do journalism another day, having that deep background and experience would help later on. So that's when I went back to school. And from there, I've actually wound up doing a bunch of research in different pieces, everything from behavioral change, also to looking at disaster risk reduction and waste management, also in Indonesia, as well as in Baltimore in the United States. And then after that, again, after school, I wanted to go do something, but I couldn't quite figure out where or with who. And so I did a little bit of some ad hoc research at the time with some professors that I had worked with. And it was a great way to see what I was interested in, really, because when you get down to it, it takes a long time to go through qualitative data, to clean data. So really getting to the nitty-gritty of getting through that research. And on the side, again, I worked another job. And then after that, I ended up applying to a couple of different positions, not really getting positive responses for a while. Saw something I was completely underqualified for, required a PhD, but was amazing. And it was so cool and it was super interesting. So I applied. And that was actually a fellowship I did with Action Against Hunger. And it was a fantastic opportunity. But it is kind of my first lesson for everyone to, when you find something that say, oh my gosh, this is amazing, always apply. And that's kind of how I really got into humanitarian work. So I was with them for a little over a year, did some work in Kenya, then Uganda, and then most of the time in South Sudan. Throughout the country, I was a bit roving. And after that, they ended up offering for me to stay 1 more year. But I had, in that time, also gotten married. So regular life kind of intersects during my R&R for 1 week. And so I decided to take a position based where you can live with your family. And so I ended up starting a role with International Organization for Migration. I was not working on health in that role, but I was very much still working on migration, which was very important to me, working in South Sudan, and working a bit more on the data and data management side of things. And after a couple of years with them, I realized I really missed health a lot. And I was reading books about outbreaks. I was listening to podcasts and doing extra training online. And so I just decided it was time to go back. And so that's when I saw the opportunity open up with the Federation. And also starting my discussions with Candela on a lot of work, and started with them. So I've been with the Federation for Red Crescent National Societies now for about 4+ years, and have been working with them on everything from community-based surveillance, which is where I started focusing. And then, of course, transitioning to just be a bit broader during COVID-19. So that changed a few things, but that's a very long story. Sorry to go over time probably, but just to give some background on the windy path sometimes.
I love it, Rachel. I don't think I knew half of this, so thank you for sharing. And I think two things that I like a lot about what you said is a lot of the questions we get from young public and global health professionals is like, oh my gosh, can I take a break? Can I work? Like, you know, should I go straight ahead to my PhD or to my master? So I think you're addressing that quite nicely. You know, there's always a path back. I think public health and global health in that way gives us much more leeway than other professions potentially, right? To come back, you know, to go and do a bit of migration work and then come back to health, etc. So I think that's really nice. And the other thing I like that you mentioned is that, you know, certain areas of global health are less compatible with family life than others. And, you know, sometimes you need to find that balance as well, right? So many decisions are a bit ad hoc, others are, you know, strategic about putting different aspects of your life together. So thank you for bringing that to the table. I'm sure people will have some questions and discussions about this. Thank you so much, Rachel. I'm moving on to Ines now. Ines, tell us a little bit about your career path. You also have a bit of a winding road, and you also shared with me that beautiful slide. Let me see if I can put it on. That showed that winding road better than anything. But please go ahead and I'll find that.
Okay, perfect. Yeah, thanks so much, Candela. And hey, everybody, it's great to be here. Thanks for the invitation. Yeah, I can really relate to what Rachel just said. I think it looks on the surface sometimes like that straight path, you know, your straight career path, but it really is windy. So yeah, I can just tell you a little bit maybe about my path. When I finished school, I had like no idea what I want to go, what I want to do in future, where I want to go, what I want to be. I was sure that I want to have like some job that would be impactful, right? And would be meaningful, like probably a lot of people are looking for. But I had no precise plan at all. And I'm still not that person who has like this 10-year plan or anything like that. So when I finished school, I first went traveling for a year or so and worked abroad, and then came back and actually decided to go to an acting school. Not because I wanted to become an actress, but because they did offer this kind of foundational year where you could just learn more about your body and did do some, you know, voice work and just be in that, theater culture scene of Berlin. And that sounded really exciting. So I applied for that. and got in, and it was really great. It was intense, but I really enjoyed that year. And during that acting year, actually, I learned about that very new bachelor in international disaster and emergency relief. And it sounded just perfect, not so much because it was international disaster and emergency relief, but because it combined so many fields that I was interested in and could never decide, you know, which direction I should go, if I should go for psychology, if I should go for social work, if I should go for international law, for example. So I got a bit of everything, and I really enjoyed that bachelor's. And towards the end, I did 2 internships that were really helpful, I think, for me as well. One particular was at an NGO, and it started as just a normal internship, but I think at the 2nd or 3rd day, they told me that one of their project manager had just left, and they didn't have a replacement for her then. So I actually got all her tasks and responsibilities, and instead of being just an intern, I kind of was the normal project manager for a couple of months, and it was really great because I had a lot of responsibilities and got to know, I think, the work quite well. Then they actually wanted to send me to Nepal towards the end of the internship. It was just after the earthquake happened. But I was pregnant at the time, so they couldn't send me to their internal regulations. I think probably my career path would look quite differently if I would have gone to Nepal at that time. So instead, I went for another internship, which was at the Ministry of Development Cooperation. And it sounds quite fancy, and it was interesting, but also it wasn't what I imagined it to be, right? So it kind of helped me to figure out what I don't want to do in the future, or at least not for that moment. So after that internship, I gave birth to my son. I kind of tried to, you know, finish my bachelor's thesis while carrying the toddler or nursing or things like that, and it worked out well. And like when he was a year old or so, I started to look for a master's degree. And again, I wasn't really sure what I wanted to go for. And also I had to find this kind of degree that I could manage from home with the toddler at home. And then I decided to apply for 2 different masters because I couldn't really decide. One was in global health at the University of Manchester, but it was a distance learning course. And they offered this kind of 3-step master, right? You would do the postgraduate certificate in the 1st year, then a postgraduate diploma, and then the master's in the 3rd year. So I said, okay, I will just do the certificate first and then see how it goes. And at the same time, I started a master's in Caritas Science and value-based management, which also sounded really interesting because it was a lot about leadership and also personal development and things that also really interested me. And I thought, okay, I'll just have a look and then, you know, decide after half a year or so. I ended up completing both masters because actually they contemplated each other quite well. The global health master was really challenging on like an intellectual side, I think, for me, also because it was English, it was a foreign language for me. I think academic writing in English is something completely different to academic writing in German. So it was kind of challenging, but I liked it. And at the same time, I really enjoyed the master's in Germany, the one in Caritas Science and value-based management, because I did have like this kind of campus life, right, which I didn't have in Manchester. And it was just a totally different focus there. So that worked quite well for me. And during that whole time, as Candela mentioned already, I volunteered for a number of organizations. I put just a few here. And I think that really helped me because, for example, at one of the NGOs I was volunteering for, it's a student-led German NGO that works on equity in education in sub-Saharan Africa. And I had different positions there. For example, I started as a project manager, later was a member of the board and also chairwoman and the treasurer in the end. And I really could use everything, a lot of things that I learned during my master's already as a volunteer, right? I could implement a lot of what I've just learned. So that was really great. And then I did the internship at Alanda, which also helped me, you know, to figure out where I could go, what options there are. So that was also a really great experience just after my master's. And I found this job as a project manager for a German NGO, which is called German Institute for Medical Mission. And it was a bit similar to what Rachel just said. I was totally underqualified for that job. because they were looking for this person who could speak French fluently and work together with Ghanaian stakeholders. And I never learned French. I didn't even have French in school. But still, I thought, okay, it sounds super interesting, and I will just apply and see how it goes and what they will tell me. And in the end, they had 2 candidates shortlisted, which was like another person and me. And this other girl, she actually was a native speaker in French and English. So she really had a lot of advantages. But for some reason, they thought I could fit the position better. So in the end, we both started, but I was working on the project because they figured that I bring some experience from that volunteering. So I worked there for a year because it was a temporary position. It was third-party funded. And if you find yourself in the NGO world, I think it's often a challenge to find like a more long-term or middle-term contracts at least. So after half a year, I was already, you know, keeping my eyes out a bit for something new. And I came across this job position at the Technical University of Munich, which was looking for a research assistant, but also somebody who would support a proposal for an ERC grant, so a large funding at the European Research Council. And the topic was economic violence against women. And that was really interesting. And they were actually looking for somebody who could start right away, but I was still in this other job. So I started this job as well, but like part-time only. And the same situation happened like half a year later. So I found this other job position. I didn't really look for jobs at that time, but it just sounded so interesting. It was about maternal health care in Germany. And I wrote both of my master theses on maternal health care. So I was like, yay, that sounds perfect. And I will just apply anyway, even though they were looking for somebody who could start right away, like with 70% or so. And I could only offer 20% at that time. But for some reason, I got in. So again, I was doing like 2 jobs at the same time, which was challenging because, I started a new job like every half a year. But I think also gave me a lot of experience in a very short time. And that's where I'm now at, actually. And I will probably finish that project by the end of the year or early next year. And at the same time, that ERC proposal came through. So we got the funds. And that's why we do have also funds for a PhD position. And I'm most likely going to start a PhD next year, which I never thought I'll gonna do. Candela knows about, that challenge of, being in the field or being in academia I am having. But I'm very much looking forward to that.
Thank you so much, Ines. And I think, the picture is amazing. That's why I wanted to show it, the slide that you created. I love a lot about the things you said, because I think many of these questions come up again and again, and you and I have discussed them during some of our sessions at Alanda. But it's like, do I have the right credentials, right? Like, do I put my acting skills or my acting school in my CV? These sort of things. Go ahead. There's always transferable skills, right? So I think you're exemplifying a lot of this. And as with Rachel, I love that you're applying for things that, you're either underqualified or you can't start right away when they ask you to, but you still apply and then it works out. And a lot of people, I think we self-censor ourselves, right? So we tend to not apply because, I can't start right away or I'm underqualified. But things can work out. And, as I like to say, the no, you already have it. Like, next step might be a yes. So why not? So thank you for that. And I also wanted to make a comment on what you said about, okay, that sounds really interesting, but in the end, it wasn't so much. But, we also learn from things that don't turn out well and what we don't like. So I think that's also great to point out for the people listening to us today. And I just want to remind everyone that if you have questions as our guests speak, please just start typing them into the Q&A chat, and we'll take them up once we finish with all the series of questions that we want to ask our guest speakers today. Thank you, Ines, again for that. Tinny, you're up.
Hi.
Hey, Tinny, so good to have you here and so good to see you again. So I'm very curious because I don't know the last steps in your career path. But I'm gonna ask you to tell us your career story a little bit from the beginning. And I know you've just you're not too far away from completing you completed your master's not too long ago. So you're just starting out, and I think those lessons are quite also important for the people listening to us, because when we bring in people who have a lot of experience, it's like, oh yeah, that's easy to say when you're there, but you know about all the struggles and we've talked about it. So I think it's really great that you can be here with us today and tell us about how you've managed your career path and transitioning from the biomedical sciences.
Yeah, well, thank you, Candela, for having me. And it's an honor to be able to be on this panel talking a little bit about my backstory and how I got here today. So I initially wanted to go into medicine. I think ever since I was probably 4 or 5 years old, I said, I want to be a doctor. And everybody in my community supported me because it was such a noble career path for someone back in my hometown, and also just being Asian, that is something that plays into a lot of your expected career success from family and friends. And so it was something I chose. Nobody really forced me to do it, but I really worked hard towards defining my interest in medicine. And so in high school, I joined a lot of clubs that were related to healthcare. And then that could really help me get into a medical program in my undergrad. And so I'm based in the States, maybe to give some context. And so in the States, in order to go into medical school, you have to get a 4-year degree first, a 4-year bachelor's, and then you can apply to medical school. And then afterwards, there's residency. And so it's a very structured path and very clear and easy to follow. All you really have to do is follow the professor's advice, take your exams, and then you pretty much get a medical degree. And I mean, it's hard work. Don't get me wrong, it's hard work, but the path to being a doctor is very clear. The path to pretty much anything else is not very clear. But I really enjoyed that sense of direction. And so also in undergrad, I took a lot of courses, I volunteered, I conducted clinical research, I became a teaching assistant just to bulk up my resume for medical school. And while all my activities looked very good on paper, my class and my test scores were not very good. I was not doing well in my basic classes like biology or physics, cell biology, microbiology, all the classes that are required to get into medical school. I was not doing so well, and I was probably maybe 50th, 60th percentile compared to my other classmates. And so that didn't really make me a strong applicant. And that was really the first turning point of reconsidering my path for medicine. But I was someone who was very determined to make it work. And so I would try to study as hard as I could and try to make up for my lack of grades in other aspects. And so I worked really hard in doing research and developing data. In that sense, I took on internships at local hospitals and just really trying to show off my skill set and trying to prove that sometimes skill is just as important as knowledge. However, during my final year of university, I actually took my first public health course, and that course was about the pros and cons of the different healthcare systems around the world. And it was basically highlighting, no healthcare system is perfect. And I'm sure maybe you guys have heard people say in the States, like, our healthcare system sucks. But after going through that class, you learn a lot of the nuances of why one country's healthcare system might not be able to easily just transition into another country's. And that really opened my eye to just understand how you can utilize resources with what you have and how to improve people's lives and their health, etc. And at that point, I was really at a turning point where I had to decide what I wanted to do next, because I was about to graduate. Do I continue with my medical school path, because I had already submitted all my applications and I was just awaiting for a decision? Or should I transition and potentially explore public health? And so I talked to my professor who was leading that class, And he said, medical school can wait. Why not explore your path right now, the public health path right now? Because, maybe in 2 or 3 years, you would be interested in medicine again and you can continue going. And so his advice really helped. And with that, I wanted to look at schools abroad because I wanted to get a more global perspective. And my professor said, if you want a global perspective, then you got to, go outside the US and really see what it could be like outside of what your comfort zone is. And with that, I landed at the University of York in England to get my master's. And during that time, it happened to be at the height of COVID. So all of our learning was distance-based. Everything was shut down. And, you're just isolated in your own flat doing classes, trying to understand and go through all your lessons and teachings and exams in that way. But I also was lucky enough to be an intern with Candela at Alanda, where I really got to explore public health in a more application-based way. So I got to work with understanding how to write short form content and how to develop proposals and a lot of different kinds of papers and reviews. And those kinds of skills really helped me understand maybe it's something I could go into afterwards. But of course, I was still struggling to figure out what I wanted to do. I was still considering medicine at that time. I was like, maybe I could go back to medical school after getting a master's, but maybe I don't want to because it's another 4-year commitment for just schooling. And then it's another minimum of 3 years of residency before you can even practice on your own. And that to me just didn't sound appealing anymore. And so I started questioning what I wanted to do after I graduated. And I think after I graduated, I got to travel a little bit around Europe. That was something that I really had to convince my parents because they were like, you're a young girl, you are alone, and you're going to, something bad is going to happen to you. So that was a whole conversation I had to have with my parents. And it's not common for us back in the States to just travel off solo in another country. And so after traveling, I went back home. I moved back to the States with my parents and I started my job search. And at first I had no idea where to even begin. And all I remember was a conversation with someone who told me, if medicine doesn't work out, you might make a good project coordinator because you love to organize things. You love having structure to certain daily aspects of your life. So a project coordinator probably would be up your alley. And so with that, I basically Googled all project coordinator positions. And on LinkedIn, I would just apply to everything that I could see that was in like the healthcare field. And that didn't lead to many job offers at all because I wasn't really taking my time to look at the job description and see how I really aligned with the company and the values, and then also what I could provide in terms of my skill set. And so, sorry, my office likes to turn off its lights every 15 minutes. But yeah, so I would just constantly be applying to anything that said project coordinator, and LinkedIn makes it very easy with that easy apply button. And so I would literally click easy apply, easy apply, easy apply, send my resume. And basically I was hoping whatever stuck would come back to me. But looking back now, I was wasting a lot of time on my job search. But at that time I didn't know. And so when just searching for project coordinator positions in healthcare wasn't yielding any results, I started to expand the potential title of that job. And so I asked myself, what do I like to do? What's my interest outside of potentially a career path? And I realized that I was actually interested in learning more about marketing, more about business, and more about finances. And so I was trying to search for marketing positions and business positions, still in the healthcare field though. And eventually I actually did find a position at a startup, a healthcare startup, where we had a software product that connects patients to their providers and makes the communication a little bit easier. And in that role, I was the marketing lead. And so my job was to create email campaigns, flyers, and to reach out to potential clients on, I guess, sharing more about our product and then hopefully closing a sale. And I think that startup was a really good opportunity for me to learn more about the business side of things. And then because it was a startup, I was also wearing many hats because, we just didn't have a lot of resources or enough team members to cover a lot of the responsibilities that were required to run the business. And because of that, I started getting into the software development side, having to test the product, the code and like debugging things, which is something I've never even ventured into in my life. I also contributed to a lot of the business strategy side, figuring out how to write the scope of works and how to give a proposal to a client and all of those things that lead up to the closing of a sale. And because I was involved in so many different departments of that company, I started evolving more into like a project coordinator or a project manager role because I was communicating between every single department internally, but then also communicating with all our clients externally and understanding like what they needed and all of that. And so through that experience, I was able to develop a lot of project manager experience without actually having that title or coming in with that title. And at that time, like about a year in, I would say I was starting to look for a new job just because this company was no longer functioning in a way that could be supportive for my career. And so about a year in, I started looking for new jobs, and I would be very particular about tailoring my resume and writing cover letters to all these positions. And I spent about 3 months trying to find a job, and I couldn't land anything. And it got to a point at my startup where I felt like I was just receiving no support at all. And it was a hard decision for me to decide whether I want to continue in this position or leave without having another job lined up. And I made that decision. It took probably several months of deciding, but I did end up choosing to leave that job without having another position lined up. And that led to 6 months of unemployment. Not intentional, but with all the layoffs happening in the tech industry, it just wasn't a good job market for us in the States. And so in those 6 months, I started to revert back into what I knew how to do for job applications. So I would basically go to LinkedIn, I hit easy apply, and I would apply to every single job that I saw. And sometimes it led to interviews, but none of them ever led to a job offer. And after about 4 months of doing that, I got so tired of just feeling like I'm spending time and not getting the results I wanted. And so I know Candela always said to be very picky about your targets, spend your time focusing on that because you have a much higher chance of, at least getting your foot in the door if you actually spend time on your application. And so I started to make a list of companies that I would like to work for here in the Seattle area. And then I would go onto their website and check on a frequent basis what kind of job openings they had and, spend actually time tailoring my resume, writing a cover letter, and then also following up on LinkedIn if I could find the recruiter or the hiring manager saying, hey, I applied for your job. I would love to have a chat with you. Sometimes that helped me get an interview. A lot of times the recruiters just didn't respond to me, but that's okay. And I spent about a month doing that with no offer still. And so I decided to be even pickier. And I decided to go for one company and one company only, which is the Fred Hutchinson Cancer Center here that I'm currently in now. And I only targeted this company because I know someone who works here and they speak so highly of the work-life balance, the collaboration, and all the wonderful and positive things that I've always wanted to be a part of. And because of that, I started to only look at job postings made by Fred Hutch. And I would apply to everyone that I could see myself fitting in. So usually project coordinators or research coordinator positions. And I think I applied to maybe 20 roles here at the time. And I think eventually I found a project manager position that aligned so well with my career goals and my ambitions, what I wanted to do. And I applied for it. I got the interview right away, actually. And all the interviews afterwards were so fast at the same time. And I think it just aligned well with the timeline that I needed, and then also with what I want to do. And now I'm here as a project manager at the Fred Hutchinson Cancer Center. And I'm really excited to continue doing research with the professor that is leading all of the studies.
Oh, thank you so much, Tini. I really appreciate your vulnerability and opening up about all the struggles, because I think a lot of people who are listening in today, they share those same struggles, and people don't normally talk about them. You know, we tell the story, you know, backwards as if it had been so easy, but it's not, and it's a struggle, and it sometimes involves not being employed for a while and making hard decisions about staying in a difficult place, as opposed as, you know, choosing between that or being unemployed, or the risks of not finding a job right away. So thank you so much for for sharing all of this. I think it's really important. Great. We are going to go on to our second question that I want to ask from the three of you, and I'm going to ask Rachel to pop back up on video and tell us three things that you love about your current job and organization, and three things that you know, there's in every job, there's some things that we don't like, and I think it's important to highlight those things as well. So that would be great if you can, just tell us 3 and 3.
All right, I will do my best. I mean, honestly, a few things I love about my current job is although I am based in Geneva, I still get to work very closely often with, for us, National Red Cross or Red Crescent National Societies. So those are organizations who do humanitarian work on the ground in their own countries. So it includes places like, I know they were talking about the US, so American Red Cross. It also includes, I've worked very closely with the Red Cross of Burkinabe, which is Burkina Faso. Worked very closely with Red Cross Kenya, Indonesia. And so one of the great things in my job is that I'm able to connect still closely with the colleagues on the ground doing the real work. And that gives me a bit of energy every time I visit, every time I'm on a call with them. So it's amazing. Some other things I personally love about my job is I might complain about it, but I actually love the chaos a little bit. I think Candela knows what I mean. I wouldn't still be here after a few years if I didn't, I think. So I like having a bit of uncertainty when it comes to every day. I don't like getting up and knowing exactly what will happen that day, to be honest. So one of the things I like causes stress, but I also love, is that I have a few very different tasks that I work on that I find interesting. But at any moment, if an outbreak is declared somewhere, I have to focus all of my time immediately to make sure that we have the resources they need, that we can share the information we need to with the operations team, and move on from there. And so it just gives me a little bit of spontaneity, I guess you can say, to the daily work. There's a lot of things. Maybe I start going with a few of the challenges. Some of them were touched on by some of the other panelists. But working in humanitarian sector, and I'm sure a few of you of the participants know as well, it can be a bit challenging to feel like you're steady in some ways. And this is a challenge, I think, for most organizations, whether big or small. And so that's something where you're just constantly needing to balance a combination of the work that you're doing, the support you're providing, and also constantly fundraising or ensuring you're aligned with the primary donors or the primary area of work. Sometimes that can get a little bit tiring, I will say. Some of the other things are also, I mentioned very briefly, I've worked a bit in the private sector, I've worked in research, I've worked with small NGOs. I was a raft guide for a short time. I've also worked with the UN. I've worked in the field, I've worked in HQ. So all of those things, sometimes working with a larger organization, certain processes can feel a bit slow and heavy. On the right side, I've had different experiences, so I also in some ways know where some of the processes are coming from, which I think helps me manage more than others. But I've also worked with very small and nimble groups, so balancing that is always a source of some frustration, shall we say. I think that's more 2 and 2. To be quite honest, I love the content in what I do as well. And this is something I mentioned with, when I applied to a fellowship, but for me, what I actually do is super interesting. I feel like I learn something new every single day. And if I don't know the answer to something, I need to look it up and figure it out or find someone who does. And that's amazing. And that's not true for everyone and everywhere, and it doesn't need to be true, but it is something I love about my job as well. And I'm a little bit, I feel like I covered a few with some of mine. So I think those are the key things. Yeah.
Thank you so much, Rachel. I think that gives a good picture, right? There's always this balance between, the benefits of working for larger organizations and the bureaucracy that comes with it. And yeah, we've all faced those challenges. So it's always an important thing to consider when, you're an impatient person that really dislikes bureaucracy, I think. That's great. Thank you for that. Ines, can you?
You are muted, Candela, I think.
Oh, sorry, that was a mistake. Just to say, if you can pop up and answer the same question as Rachel. I want to leave enough time for questions, so if we can keep it a bit brief, but 2 or 3 things that you really like about your current job, and 2 or 3 things that you dislike, understanding that there's always things that we will not like in every job.
Yeah, sure. So what I really like about my job is the variety of tasks, I think. So no day looks like the other one, I guess. So every day I start new, and I can really pick from different things I need to do. And it's also mainly my responsibility to really choose the tasks that I'm gonna tackle at a daily basis. And I'm very grateful for Candela's tips on, prioritizing tasks and all those tools she shared with me when I was an intern, because that's really helpful. And I need to remember that every once in a while to not get lost in that big variety, I think. And what I also like is the flexibility, I think. So especially when you try to balance family and work, I think for me, it's really helpful to work whenever fits best for me. So I'm not fixed to specific working hours. I can schedule the meetings when they fit for me, and it can also work in the evenings, for example. The background on that is that comes this 24/7 availability, and I think that's quite widespread in academia, at least in Germany or the universities I was working with. And while I can go all in when there's a deadline on urgency, that's not the issue at all. But if that's on a regular basis, if people don't take their weekends, if they're available during their vacation, and if they respond to emails in the middle of the night, I don't think, at least for myself, that that's very healthy. So I think that's always the challenge, to draw a line there without fearing too much of it, that it looks like you are not engaged enough. So that's something I'm find quite challenging in that field. And then I think I'm also missing the work on the ground sometimes. So currently I'm interviewing a lot of project managers, and I sometimes feel like I like the interviewing, right? I like the research about it. But sometimes I think, like, instead of evaluating the project, I would rather be implementing it. So I guess that's also something, I sometimes miss. It's not so much that I dislike it in my job, but I just miss, yeah, in general.
I know where you're coming from. I've had those same issues a lot, so I can relate. Thank you for that, Ines. Tini, you're up. I know you're quite new to your current job, but can you tell us a little bit what you're liking so far? You mentioned some of the things that drew you to this organization and the start, but quickly two or three things that you like and a couple of things that you don't like as much.
Yeah, so I think one of the greatest things that I really like about this job is the flexibility that the position offers. We recently started going back into the office, but there was no expectation to actually always be in the office. So we can actually choose the days we want to work from home if we want to. And I like that flexibility a lot. The work-life balance that I mentioned briefly earlier has been something that I enjoy. There isn't too much of a pressure to respond to emails right away or to be available 24/7, unlike Ines sometimes feels that pressure. Unfortunately, because of this work-life balance, sometimes if you have pressing deadlines, it can be hard to get a hold of certain people and to show that sense of urgency that you need. So that is a drawback for this work-life balance. I can't really think of something else in terms of drawbacks because I've only been here for a couple of months now. I'm sure, after several years of working, I can find a little bit more. But as of now, I think it's just trying to get people to feel that sense of urgency when a deadline is approaching is something that I struggle with. But yeah, I think this job has provided a lot of benefits so far in terms of flexibility, working from home, and then also caring for the employees' mental health and wellness.
That's super important. Thanks for pointing this out. And yes, of course, when you start a job, it's normally this rosy period at the beginning, and then you start seeing the downsides, but that's totally normal. So I'm very happy for you, Tini, and very cool to hear the next steps in your career path. I would ask you to stay on video and ask Ines and Rachel also to pop up. I can ask you the third question on my list, and then you can just stay on camera so we can start with a Q&A. So Rachel, what advice would you give? I know this is like, you could spend an hour doing this with all your experience, but what one piece of advice would you give to young public and global health professionals who are just starting out, and or to people who are switching careers right now after, a spell of some years in something else into global or public health?
I mean, honestly, I think I'm a bit of a jumping in type of person. And so I think if you are just graduating and you have an opportunity and it's the first time away from home, for example, or the first time working in a place where you don't speak the language, for example, if it's an option, practically, given family and other decisions, because they're equally important, I highly suggest to take it. And then whether you like it or not, and it's a fantastic experience, I think, either way. That would be my strongest advice. Switching careers, I also think, and don't be afraid to highlight what you have as an added value from your previous experience. I fit ski boots for several years. I have learned a lot about managing some very picky people and how to keep a face sometimes. I'm better than others, but how to kind of manage some weird problems that people bring up, or how to manage certain things from those experiences, from tech, from science, from medical degree. There's a lot of background that we bring that sometimes I think people forget can be transferred. So I think that's extremely important to remember as well. Those would be mine.
I love that. And I keep insisting on that. Like, don't, just remember your transferable skills. If it was in sales, if it was, at a restaurant, you're always picking up invaluable skills. So don't hide them because they have nothing to do with public or global health. So thank you for reinforcing that message, Rachel. Ines, you're up. Best advice. No pressure.
Thank you. Sorry, I was still so focused on what Rachel just said, and I think it's just so important with those transferable skills. And I was thinking, I guess it doesn't only apply to previous job experiences, but also to your personal life, right? So, for example, I had that issue when I had my son, and I was figuring, should I put it on my CV? Should I mention it? Or does it limit my chances to actually get the job or not? And then I started to be open about it, but use it as a benefit. And for example, emphasize that my time management got way better because I have to handle all that at the same time. So I think don't underestimate what you've got already, and really reflect on the experience you have in your personal life, but also in your professional life, in your volunteering. And the job offers, it's not always, you don't always need what it looks like you're gonna need. For example, I'm working now as a researcher, but what I'm actually doing, I don't know, 60–70% of my time is project management, for example. So really reflect on the role and the different tasks a position comes with, and look what you've got and put it into your CV and your cover letter.
Thank you for that. And I think that partially answers someone's question about the difference between project officer, manager, and coordinator. And I think it really, you really need to read the specifics of the job description, because sometimes the title of the job doesn't have much to do with the requirements of the job. But we'll go back to that question. Tinny, you're up. You've been through a rough job hunting and a rough first startup experience, even though you learned a lot. So what's your best advice to all our young public and global health professionals who might actually be looking for jobs or, finishing their studies, etc.?
Yeah, I would add on to Rachel and Ines in terms of transferable skills, but before you even understand what that job is or finding jobs, the first thing you have to do is just starting that job search, and that could be really daunting, not knowing where to even begin. And so my advice would be to reflect on the current skills you have that might be career related, and the current skills that you have that are personal interests, and then understand how that can be migrated maybe into a more public health related aspect. And so public health is so versatile, and almost every job might have a public health spin. And for example, if you're into illustration and designing, maybe you could be a graphic designer for creating flyers for the marketing team at a healthcare organization. And that's not something I ever thought of before I really, looked into myself. Or maybe you like, planning events and hosting your friends and family, then you can be an event coordinator for an organization that does a lot of community outreach. So really understanding what your interests are, what you're really good at, and then being able to find a job that might not necessarily have the title public health, but could have a public health spin or a public health related aspect to it, could really help you find a job that you are really interested in and wanting to continue in.
That's brilliant, Tinny. Thank you so much. I think sometimes we, the search terms that we use for job hunting can limit us so much. So it's good to give that spin that you could work in a healthcare organization with a job title that has nothing to do with health, even though your actual work would involve health related knowledge and skills. So thank you for pointing that out. I think that's really important. And we have quite a bit of questions in the Q&A. I saw that, Tinny, you very well answered one of those questions. I think I'm going to try and take them in the order that they appeared. I think the very first one came in the chat, and it's from Brudo Donga, and it says, may I ask for a summary of the different roles of project officer, coordinator, and manager? Anyone of you want to lean into this? Maybe Rachel, you can talk about how this looks in the humanitarian side, and then Ines maybe explain a little bit, and Tinny on the research side.
Yeah, I mean, I can start, and then just to reiterate what you already said, Candela, it really always depends on the organization, and also sometimes even the team, I have to be honest, what that means. Often, at least in my experience, kind of program officer, usually you'll have a manager who is assigning you tasks and who's also there to support and mentor you. it would probably be closer, you know, when I worked in South Sudan, for example, it would have been more like a program officer where I had, for a while, where I had a manager who kind of would tell me, okay, we need to do this survey in this location, and give me kind of the budget that is available, and what is needed to be done. And then I would go with that. Program manager is typically where you have one or more people that you are responsible to manage, whether or not that's on the field, whether that also sometimes is more on a portfolio as well. So it could be, so for example, now on a global role, I don't necessarily manage people, which I miss, but I manage more a portfolio of activities. And so it's ensuring that those things get done in a timely way. And so that might be managing with people and maybe kind of some of that more nitty-gritty technical stuff. I feel like I've missed one of them, but those are some of the key differences I would notice. Yeah.
Thank you, Rachel. I think that, yeah, I think that's my same experience in the humanitarian field, and it looks potentially a little bit different in the research side. So let's hear from Ines and Tini. Ines, do you want to go first?
Yes, so actually I didn't come along any colleague by now who is officially having the position of project manager or coordinator. Of course, there are people coordinating and helping, but normally they're just research assistants or researchers, right? So all those tasks that you would think of a project manager normally has, like Rachel just explained, they're just part of your task as being a researcher. So for example, what means project management for me is to also manage all the activities, planning interviews, you know, getting in touch with all the interview participants, having the timeline in mind, also coordinating with our funder who's funding the research project, things like that, and then managing a small team of PhD students as well. So it can probably look very diverse, and it differs from team to team and organization to organization as well. Yeah.
Yeah, absolutely. Tini, how does it look like on your side?
Yeah, within our organization, it depends on whether you are more clinical or if you're more lab-based. So I'm clinical, so usually each project might have one or two main point of contacts who do a lot of the coordination between patients and scheduling and meetings. When it comes to lab work, usually you're the only one conducting the bench work and collecting data. But on our side, as a project manager, I manage all the studies that are under this one professor. And so I make sure each research coordinator is hitting their milestones, is recruiting the amount of patients that they need for that week, is on track for writing their manuscript or submitting paperwork to get approval from our IRB, which is our institutional review board, to get the study going. My job involves a lot of coordinating meetings with our external collaborators as well. You know, if we need to work with hospitals or maybe another institution for external resources, that is my role. But there is a lot of project management and coordination that goes in within each study as well. For us, their titles are coordinators. And then for mine as a manager, I manage every single person who does a study underneath my professor.
Brilliant. That's a fantastic example. Thank you. So I hope that answered the question. It's basically different in every organization and in every sector. So by all means, use those search terms, but look into what the job entails, because they can be a little bit restrictive if you're just looking for one of those search terms instead of another, thinking that it looks the same everywhere. The next question that came in, I think, was from Coralie. She says, we often talk about the power of networking. To what extent did you all three use networking in finding these interesting jobs? Or did you all apply online without knowing people in your future teams? Tini, I would love to start with you because your experience is so recent.
Yeah, so for this current job, I was actually lucky my partner works here. And so I was immediately plugged in different ways with his group and his lab. And there's no for our organization, there's not really much connection between the different divisions, because in academia, when you work under a professor, they're kind of their own little team. And so I didn't have a leg up because he worked here, but I was very familiar with all their policies, all their missions and values. And during the interview, I was able to talk a lot about how that aligned with my passion and my interest as well. And I think that helped me get the role that I'm in today. I know that's not the situation for a lot of people, but that was my experience.
Thank you, Tini. Yeah, I think that's very important. And there's different ways of doing it. I mean, in your case, it was very easy or easier because your partner worked there. Ines, what about you?
I never knew anybody who would work in the same team that I was applying for. However, I was connected to people who shared the top position. So I think networking in that sense also can be really helpful. And I encourage you all to follow people, organizations that you are interested in, because otherwise I wasn't checking the normal job platforms, right? I wasn't looking for jobs at that moment often. So just being on LinkedIn and seeing what offerings there are can be really helpful already. And what I did also was to get in touch. I was connected to if a connection in LinkedIn, for example, would share this job description, then I would text her and ask if she's linked to that in any ways, if she could give me some advice, if she knows the people who are working in a team, for example.
I think that's really important, right? Because what you're saying, it's the same as Tini is saying, when you go into the interview, but even from your cover letter, you can bring in that little extra because you know a little bit more about the organization or the team or the project. And I always tell people to do their homework and research as much as possible. And that research can also involve talking to people. So I think these are great examples. Rachel, what about you?
Yeah, I feel like I'm kind of a little bit more the old school person here, because a lot of my stuff was before that apply now button existed, I think, on LinkedIn. Honestly, one of my best friends works in the health and care department at IFRC, but I met her before I started working here in Geneva, and also she wasn't part of the hiring team or anything like that, but it did give me an understanding of what opportunities came up. Right when it got posted, she messaged me and said, "This is exactly what you wanted to do." And it also gave me a bit more, sometimes it's also about building that confidence and that repertoire, talking with people and understanding the culture of an organization, or I think this is also true in the private sector, and knowing kind of just the body language, how to talk, how to feel when you, as you mentioned, when you're in an interview, because I think that's quite important as well to understand how the teams work together. So yeah, my other ones, I didn't know anyone actually.
Great. Thank you, Rachel. So yeah, I think it's the question about, knowing, having that advantage of knowing a little bit more about the organization, even if people don't put in a good word for you. So that can really help. That's what the networking is about. There's a question from Joshua. Thank you for this enlightening session. I am currently an undergrad doing some volunteer work in public health and health policy. 2 questions. Is there a possibility for me to have a public health offer as a student? And what advice do you have for me to stand out in my future job search after eventually graduating? Should I start with you, Ines, this time? Is that okay? Or is there anyone who particularly wants to answer this? Maybe if somebody
already has it in mind, then please go ahead.
I could actually answer. It's not from my experience, but it is one of my classmates back at York. And so we were still in the middle of our program, and one of our courses had different kinds of professionals come in and speak more about their role and their jobs, kind of like what we're doing now, but each week a new person would come in. And one of my classmates actually messaged one of our panelists after the talk and asked if there's any opportunities that she could, get plugged in right away. And they actually offered her an internship for, I think it was doing disease surveillance in London. And she got to experience that kind of more working life as a student, just because she asked someone afterwards, after our panelist talk, saying, I would love to connect with you, you know, is there any direction you could point me to for jobs?
That's brilliant. Thank you so much. I think, Ines, you have also done a lot of volunteering and actually, you know, internships and other things while you were studying. So yeah, do you want to add something there?
Yeah, I was just thinking when Tini told that story that I did the exact same thing. That one time it was like a big event and it was about sustainable fashion and standards and things like that. And then it was like somebody from the ministry who said, you know, you can come with me to Bangladesh actually and see how it's happening. And after that panel discussion, I went to him and I was like, okay, I am going to go with you, right? I want to see it, how it works. And we already planned everything. And then in the end, it didn't happen because they wanted me to pay quite a big amount of money to be able to join them, because only the most expensive hotel was, you know, still available. It was everything very much on short notice. So that didn't work out. But instead, I got this internship at the ministry. So that's how I ended up actually at the ministry. And I think doing all those internships and also volunteer work, it's so valuable. And if you can show that later on when you're applying for jobs after your graduation, it can really put you a step ahead, I think. So for example, when I was applying for my first real job, so to say, after my master's, the director told me when she offered me the job, she was like, oh, that's such a great chance for you, right? It's your first real job. And you can start with such a great position. And I was like, yeah, but it's not really my first job in that area, right? I've worked for another organization as a volunteer for 7 years or so. So I've done already quite similar tasks. And I think that really helped me to be respected a little bit more when I started the job, and also to negotiate my salary, for example. So really use that experience that you get from internships and volunteering.
Brilliant. I totally advocate for that. And, you know, for some reason, we think that a volunteering position or volunteering work is just somehow not as important as a paid one. And you might be doing exactly the same tasks in some situations. So, you know, I advocate for people to putting, you know, in your work experience, your volunteering experience, if it's really, you know, if you've done a lot of things and put in a lot of hours and a lot of work, don't put it as an aside at the bottom saying volunteering. Really explain the tasks and things that you were doing, because that has a lot of value. So thank you for pointing that out. Let's move on to the next question, so we have time to go through all of them, unless there's anything you want to add, Rachel, to this.
I mean, I'll let you move on because I think there's a lot of questions here.
Yeah, there is. There's a question that has been answered by Tini, but I still wanted to share it in the group because I think many people can be feeling this way. My story is almost the same with Tini, but I'm concerned with my age. I am now 35 years old with 1-year-old daughter, and most of the jobs that I found always require travel outside of Europe. I'm an Indonesian, but living in Germany because my husband is doing a PhD here. So I really have no idea what should I do for my career. I really feel hopeless now. And if you're listening, I think many of us have gone through that period and it can be really rough. So thank you for sharing this. I really like the written answer that Tini gave, but if Ines or Rachel would like to add anything, please go ahead.
Maybe just one thing that I already mentioned before. I guess there could be also difference how the job advertisements are formulated, right? If it's really necessary to go abroad, or if they expect you to be open for traveling. And for example, when I applied for jobs and they said it's necessary to be in Heidelberg, like it's a city close to mine, but it's still 3 hours travel, like once a week or twice a week, I was like, that's not possible with like my child at home. But I would still apply and then just tell them in the interview when it came up, and it was never an issue. So maybe there might still be some, you know, jobs that could be interesting for you and that you could fit in, even though it says something different at the end.
I might just add, I mean, and Candela probably has suggestions, honestly, of her own. But one of the things, depending on what you're looking to do and what you're most interested in your experience, Don't discount consultancy opportunities, honestly, in the humanitarian world, if that's the space that you're interested in. There's more consultancy opportunities than there are job opportunities. And if you already have, your residency permit, a place to live, all of these factors, and it's really just about ensuring that you're able to move your career forward, earn a little bit of money. I strongly encourage to look into consultancy opportunities, both advertised or even if you see an interesting project that you think you're a good fit, to reach out to the team and see if they ever need a consultant to let you know.
Yeah, thank you for that. Yeah, I think consultancy gives a lot of flexibility that makes life easier, especially when you have small children. And it's sometimes easier to break into because it's not as, tight a contract with that organization as an employment contract. So people might be, a bit more flexible around it because it might be, a contract for 3 months or for 6 months. And it also gets you a foot in the door. So similar to volunteering, if there's an organization that you're very interested in working for, there's always that opportunity to go in through the volunteering door or the consulting door, because it'll give you understanding of that organization and know like a network inside it. So potentially considering that. Thank you for these very thoughtful answers, ladies. I'm trying to get through all of them. We have 10 more minutes to go. Where can I find remote internships as pharmacist who is interested in public health? I would say LinkedIn, Glassdoor, Impact Pool. Anyone else wants to join with the list?
I think actually one idea is following recruiters who usually highlight remote opportunities, because these are the people who want to fill those positions. And so if you are able to find recruiters who work with multiple different kinds of companies or is very knowledgeable of the different job boards that offer remote positions, then that can actually help with your search as well.
Brilliant, thank you. Anything else to add? We're good? Okay. The next one is from Kendra. How can public health students use their public health education and skills to break into teach program? I don't know if it's teaching or tech, program management, etc. I think part of this has been answered basically by your career stories, because a lot of what Tinny and Rachel and Ines and also Rachel are doing is project and program management. I don't know about teaching. Maybe someone wants to talk a bit about this. Has anyone had any teaching experience using your public health?
I was going to say, maybe the other two have more. Just to mention,
sorry, Kendra is saying, sorry, I meant tech. So I think Tinny can talk about this, and then also you about CBS, Rachel, maybe.
Yeah, so tech, what the great thing about tech is there's many startups. And with startups, they're not as picky with their candidates of needing certain skills or certain qualifications. They really just want someone who's really willing to work hard and then willing to learn. And so if you leverage those kinds of more soft skills, like the ability to, find answers without needing to be prompted, or not needing as much guidance or direction, these are skills that you can highlight in those job applications. And more often than not, usually the people who are hiring for startups, they just want to make sure you have a general knowledge of what they're working in, and then just the soft skills that they might need. Kendall, I think you're muted.
Sorry, thank you. I agree with a lot what you're saying there, Tinny. So thanks for this. Rachel, do you want to talk about the CBS part?
Yeah, I can. And actually, even before CBS, my job with IOM, I was information management, and I actually helped develop an app that allowed them to improve how we manage basically migrant and information across borders, which is really a challenge when people are moving from one country to another, to be able to follow on their medical needs, be able to follow on protection-related needs, and all of that. And community-based surveillance, if anyone wants to learn more, I will put, there's a new website we have just quietly launched, hoping to publicly launch, I think, the end of next week. And so it basically supports different ways in which you can detect early signs and symptoms for disease outbreaks within communities by community members and volunteers. So you don't need to be a doctor, you just need some training on some basic basic understanding of what to look for and what to report. From that effort, Candela has been very engaged in this, but there's been a process to basically develop tools that can be used in many different contexts and also across different socioeconomic boundaries as well. So a lot of times we talk about tech as this big flashy thing with cool apps. And I've supported the development of apps for some of the humanitarian organizations I've worked for. But it can also be applying old technology in a new and unique way that can make something more practically cost-effective and efficient. And this is something that's really interesting and provides a lot of opportunity. And so it's been a way that we've basically have worked to design using what now I think people call dumb phones, but simple phones, to send a simple SMS to a designated number, which can be caught through a relay now and go directly to a digital platform, which then can create dashboards, can do some automated data analysis, data cleaning, mapping, and now also can automatically then link to larger national disease surveillance networks as well, which is a really cool thing. So it's about building that link all the way down to the bottom. There's so many things within health, whether you're building the app, whether you're applying new technologies that are relevant, I would say, to how we think when developing tech, if you will. And so I think just to encourage people to think about that thinking process and how you go forward with it.
Definitely. There's a lot of opportunities in digital health. Like it's so vast, right? I think you've gotten some examples here so a lot of segues into tech, definitely from public health. If you're interested in both, that's great. And if you have some coding skills, even better. So make sure to highlight those. Here is a question from Lichita. Thank you for everyone for all the stories you've shared about your education and work experience. She's pursuing an MPH in the UK. Any suggestions on what should I do to figure out what available career paths out there could I pursue after I graduate that might match my interests? I think every single one of you have touched a little bit upon that by just having too many things that interest you. But does anyone want to dig into this question a little bit more?
So I guess my way was also to just go by chance, if you say it that way. So I was interested in so many things, and then one thing came along, and I was like, yeah, okay, I'm just gonna try that out and see if that works for me or not. And so far, like I think 99% of the things I tried out worked out pretty well, and I stick with it for quite a while. So yeah, I would just encourage you to maybe you can prioritize your interests and see what really interests you most and go for that first. But also stay open, and maybe there's another job offer comes along and it will be the perfect match.
Chance is one way to do it, and another one, sorry about the mute, and another one is, you know, attending forums like this one where you can hear people's stories. It really gives you, like, you know, this insight moments, I think. And also you can do this one-on-one, reach out to people and say, hey, you know, I don't know where I want to go next. Can I chat with you for 15 minutes about how your job looks like and what you like and dislike? And then you start getting a feeling for what might be a good option for you. Thank you for that, Ines. There's another question. I completed my bachelor's of public health and disease prevention and control, but I have been unemployed for a year. I have had the privilege to intern and volunteer in small private institutions, but public health is not a priority in my country. This is making me lose hope. I'm planning to do my master's outside of my home country. I will be grateful for support and guidance as to where to specialize during my master's. My background is in disease control, more on surveillance. I am passionate about using big data to improve the health and well-being of individuals and communities. Rachel, do you want to give it a go?
I mean, there's honestly so many options now, and perhaps if you are pursuing a master's, there's different options now that didn't exist when I did my master's. There's some hybrid options I think that are really nice, because for those who don't get a full scholarship, it allows you to reduce costs when it comes to moving, when it comes to attending if it's a large university. These types of considerations to me, I think, are quite important as well. I went to a school that's quite well known for disease surveillance and epidemiology, and that is what I focus and do now. But technically, when I did my master's, I was health system strengthening and humanitarian health. And so if you already know really where you kind of want to focus your time, you're already way ahead for a lot of these master's programs. I think the list is too long. I might be able to share like some good ones that I know about, but many across the world. And so, I mean, if knowing kind of where you want to go, what you want to focus on, if you want to move back home and work, then I think that would also be a great, I'm happy to connect a little bit more to give some other suggestions too.
Thank you, Rachel, for that. That's very kind of you. We are reaching our time. So I just want to say thank you so much, Tini, Ines, and Rachel, for your openness, for your vulnerability, for sharing your stories. And, you know, just showcasing how it really looks like, as opposed to, you know, these perfect stories that sometimes we hear and can make us feel really discouraged. So I hope this chats have given people hope and new insights and new ideas of where to look for jobs or what types of jobs to look for. And I hope you leave this panel more encouraged to keep on searching for where you want to go next. Ladies, I invite you, if you want to add any links right now on the chat before we close, whether that's your LinkedIn, whether that's CBS, whether that's anything else that you would like to share with our participants. I would also like to thank all of our participants for being here today, especially those who stayed for the full hour and a half. And thank you for your questions and your engagement and your comments. And a special big thanks to the organizer of this event, who is our dear Sabine. Can you pop up on video? Thank you, Sabine, so much for organizing this. It was perfect. And we have been doing these panels every 3 months, and I think we'll keep going. So if you're interested, just make sure that you subscribe to the Alanda newsletter or to our LinkedIn to make sure that you get the notifications if you would like to keep participating in them. Thank you, everyone. I'm going to close the session now. And thank you again so much for participating with us today, Rachel, Ines, and Tini. It was lovely to see you again.
Thank you so much.
Thanks a lot. Bye.
Bye, everyone.
Thank you so much. Bye.